Okay, good afternoon, everybody. We're going to get started. Greetings, greetings. Take a seat. There's lots of seats over here on the left-hand side of the room here, your left-hand side. Well, welcome to New Orleans, everybody. Are you happy to be here?
Woo!
Yes. Awesome place to be. My name's Auld, and I'm the CEO of the Society for Public Health Education, and it's really a great honor and privilege to welcome you to this 2016 Technical Assistance Workshop for the National Implementation and Dissemination for Chronic Disease Prevention and Health Promotion Program. Now, I don't know about you, but in DC we had quite a hard winter this year. And so it's great to be here in this warm, lovely sunshine of New Orleans. And I see many, many heads nodding. Yes, it's great to have an opportunity to enjoy this great this gift from Mother Nature. But I have to say, even us city slickers are not the only ones happy to see this great warm sunshine and beautiful weather. I was traveling out in Western Maryland just a week or so ago where we have a lot of farming communities, quite rural there, even though you don't think of Maryland and its metropolitan area as being so densely populated. But I had to see a sign as I went by this farmer and his field. And it was true to me that even the farmers are so happy that spring has finally sprung. Because when I saw this one sign, it said, "Spring is finally here. I'm so excited. I almost wet my plants."
Almost wet my plants.
But seriously, we're really happy that we can welcome you on behalf of the 5 national organizations that are part of this program. We so appreciate the time and effort that you've taken out of your jobs and your family life to be here and spend this next 48 hours or so with us. And the work that you are embarking on, which is so important to the health of this nation. We have a committed core of 5 organizations been working for, believe it or not, the last 6 or 8 months and just planning this event. And while you'll be hearing more from many of them over this afternoon and the next several days, I really want to honor them and have you all have an opportunity to see these great teams that have been assembled on behalf of this important program. Now, of course, we have our own alphabet soup. We have some category A's and category B's, which you might have already become familiar with that terminology. But I'd like each of those teams, as I call your name, to stand up and just give a shout out to everybody so that they know who you are. First of all, our team from the American Heart Association. Will you stand? All right, applause. Terrific. We also have the American Planning Association. Welcome everybody. The National Women's and Infants and Children's Association and their team, stand up, be recognized. All right. And then we have our Category B partners who are also important to the project, the Directors of Health Promotion and Health Education. We all stand? And then the Society for Public Health Education. Some of them are out there at the registration desk, but those in the room, will you please stand? So thank you very much for all your hard work. Well, a program like this, no doubt, and the progress that we're making over this important, the work that we're embarking on, wouldn't be possible without the expertise and leadership and the direction of the Centers for Disease Control and Prevention. And we are extremely grateful for the dedicated project officers, the project directors, and the team leaders in the Division of Community Health in CDC's National Center for Disease Prevention and Health Promotion. So will our CDC leaders please stand up and can we thank you? Well, friends, each of you are a part of a historic movement, if you will, that is dedicated to our policy system and environmental change around the country. And that's going to make a difference in the health of individuals and communities to make healthy living easier where people live, work, play, pray. And this 3-year project is really part of a very broad vision, if you will, if you look at our diagrams up here, that kind of first starts where we start with CDC and its 5 skilled national organizations to give us a base of evidence around policy system and evaluation change, environmental change, and work with other public and private sector organizations and partners to accomplish our work, to provide our technical assistance, training, and communications to you all there in the field, not only in our 97 communities around the country, 47 of which are represented here today, and 50 in our cohort 1. And then ultimately what our goal is to really decrease chronic disease and the risk factors for chronic disease, which cost 7 out of 10 deaths in the country every year and 86% of our nation's healthcare costs. So critically important work, the bridge that you are providing to those local communities and the health of the station. So that vision is why we're here, and the need is why we're here for this training opportunity and what we want to accomplish over the next couple of days. Now, we have some formal workshop objectives in your program, which I'm sure you've all studied very, very carefully. But I wanted to leave you with a little bit with some very practical advice and takeaways that you might have during our time together. And to keep it pretty simplistic, first of all, we kind of use that number 2. So you don't have to remind yourself a lot of 3, 4s, and 5s, but just 2 simple things in 4 different areas. First, what can your coalition do, initiate, implement, and accomplish to sustain PSC changes that lead to healthier lives and healthier communities and more equitable communities? Second, we want you to take away 2 new approaches to address one or more of the risk factors for chronic disease related to tobacco, healthy eating, nutrition, physical activity, and then community clinical linkages, which we often refer to as chronic disease management. We also want you to take away 2 new friends from this opportunity that you got together, 2 new peers that you will be able to network with and engage with over the next 18 months for additional ideas and ways to stimulate your work. And then last but not least, 2 sources or resources of technical assistance that you can take away after Wednesday and use in your local communities to do your job better. So I hope that is not too difficult for you to remember, just 2 things in each of those 4 categories, but that you'll begin to develop new peer networks, new evidence base, and new ways to accomplish your work over the next 18 months, I guess, as you might expect. So we'll also be walking the talk during this meeting, which is important to all of us in terms of eating our own healthy lifestyles, and that is having good nutritional habits and good physical activity. So we hope we'll be following the American Heart Association guidelines at this event, and we hope you'll take some time to get some physical activity in the beautiful city here of New Orleans, the streets that you can walk, but also there's a great fitness facility here on the 5th floor in the Marriott. Well, we're here to accomplish all these both formal and informal objectives, but will require us to have no less than superpowers, a lot to be done in the next 48 hours. So who else better to help us accomplish that than a dynamic duo? That's Batman and Superman. We need their help to get through the light of darkness and also help us roll on as faster than a speeding bullet. So who can we count on for bringing us home to do that? Well, our 2 skilled workshop facilitators, none other than David Gibbs and Monty Rulia, who you'll be meeting shortly too. Come on there, Monty. This is a dynamic duo of community initiatives leaders that has been working with the National Implementation Project since its very early beginnings, and they're true masters of PSC change in their careers and helping other national teams that I've actually worked with and experienced through Achieve and Community Putting Prevention to Work programs that have experienced significant success. So we're really delighted to have them as our workshop facilitators over the next couple of days. They have extensive bios. I won't do them justice. I have to say I kind of like the heads on those 2 superpowers, though, to keep us motivated. So finally, in just a little closing here, I want to leave you with one final thought, and it is this. So make no doubt the work on which you are and your coalitions are embarking is like, in the words of one of our speakers here tomorrow, Dr. Fran Butterfoss, and a great mentor of mine, it's like igniting a campfire. And while you are in the Big Easy, believe me, I know, this job that you are embarking on is not easy. It's a challenge. But the good news is that you've already started with the process and considering the need of your communities. And you're here with us today to plan and take those next steps. How you gather the kindling wood to prepare for your fire, how you'll ignite your fire, and then how do you keep that flame going and sustained? How do you stoke the coals to keep it going? But make no doubt that the light from the fire, the warmth and the heat, the inspiration that's possible, it all starts with a single spark and a single flame, and that's you. So let's get fired up, and for all that's possible for a healthy nation, and let's roll up our sleeves and get to work. Thank you.